A Gastrointestinal System and Digestive Cancer Guide. Chapter 1. Gastrointestinal System Cancers. Bladder Cancer Info. The bladder is a hollow organ in your lower abdomen/pelvis that stores urine produced by the kidneys. Bladder cancer occurs in the lining of the bladder. Abnormal cells multiply without control in the bladder. Transitional cell carcinoma is the most common type of bladder cancer. Transitional cell carcinoma that remains confined to the surface of the bladder lining is called superficial bladder cancer. It is easy to treat, but it tends to recur. If the cancer spreads beyond the bladder lining and invades the muscular wall of the bladder, it is called invasive bladder cancer. It can spread to nearby organs and the surrounding lymph nodes. Symptoms of bladder cancer are the same as those for a bladder infection or other urinary tract disorder. The most common symptoms are an urge to urinate with little urine output, blood in the urine, frequent urination without an increase in fluid intake, painful urination. Superficial bladder cancer can be treated with transurethral resection, in which the tumor is surgically removed through a cystoscope. With invasive bladder cancer, all or part of the bladder is removed using a surgical procedure called cystectomy. Surrounding organs could also be removed at this time. Other treatments are radiation therapy, chemotherapy, or immunotherapy. When the bladder is removed, the doctor will use an isolated piece of the person's small intestine to create a new channel between the ureters and an opening in the wall of the abdomen called a stoma to allow the urine to pass. The urine can be stored in either an internal or external pouch, which the person removes as it gets close to filling up. Smoking is thought to cause half of all cases of bladder cancer. Bladder cancer happens when malignant cells overtake the bladder, which is the organ that stores urine. Symptoms can include blood in the urine, pain during urination, increased frequency of passing urine, feeling the need to urinate, nothing coming out. Most bladder cancers are classed as transitional cell carcinomas that arise in the uroepithelium, lining of the bladder. Other types are squamous cell carcinomas, adenocarcinomas. Gastrointestinal System and Digestive Cancers website/GI. Cancer websites. Gastro.org, American Gastroenterological Association. WorldGICancer.com, ESMO World Congress on Gastrointestinal Cancer. Frontiersin.org/gastrointestinal_cancers, Frontiers in Gastrointestinal Cancers. gi.jco.org, Gastrointestinal Cancers Portal. American Society of Clinical Oncology. gicsm.org, Gastrointestinal Cancers Symposium. Springer.com/medicine/oncology/journal/12029, Journal of Gastrointestinal Cancer. TheJago.org, Journal of Gastrointestinal Oncology. octo-oxford.org.uk, Oncology Clinical Trials Office, University of Oxford. aimpc.org/tgc, Translational Gastrointestinal Cancer. ncbi.nlm.nih.gov/pubmed, go to, PubMed at the National Library of Medicine. Bladder cancer websites. cancer-genetics.org/x2103.htm, Molecular Biology of bladder. Cancer.gov/cancer topics/wintk/bladder, what you need to know about bladder. Cancer.cancer-research.uk.org/cancer-help/type/bladder-cancer, bladder cancer. Cancer.net/cancer-type/bladder-cancer, bladder cancer. macmillan.org.uk/cancer-information/cancer type/bladder/bladder cancer.aspx, bladder cancer. nhs.uk/conditions/cancer-the-bladder/pages/introduction.aspx, bladder cancer. cancerresearch.uk.org/cancer-info/cancers-tat/type/bladder, bladder cancer statistics. actiononbladdercancer.org, actiononbladdercancer.youtube.com, Bladder cancer. bladdercancercanada.org, bladdercancercanada.blcwebcafe.org, bladdercancerwebcafe.oncolink.org. cancer.dk/bladdereforningen, blairforningen.cancer.dk/bladdereforningen/English, Danish Bladder Society. cancer.dk/bladdereforningen, Danish language pages. ncbi.nlm.nih.gov/pubmed ? Term bladder cancer, search PubMed. Database for bladder cancer. cancer.gov/cancer topics/pdq/treatment/bladder/health professional. Bladder cancer treatment. cancerresearch.uk.org/cancer-info/cancers/types/bladder, bladder cancer statistics. evidence.nhs.uk/topic/bladder-cancer, bladdercancer.oncolink.org/n/bladder-cancer, bladdercancer.patient.info/health/bladder-cancer, bladdercancer.cancer.gov/clinical-trials/search/results ? Protocols IRCHID =9767813. Clinical trials, bladdercancer.seer.cancer.gov/statfacts/html/urinb.html, seer stat fact sheets. Bladder. ncbi.nlm.nih.gov/pubmed. turui.com, Riverside Urology, California. angelfire.com/ct3/survivor of cancer, bladder cancer survivor. apjohncancerInstitute.org/cancer/bladder.htm. beacon.org. beacon.org/medical/order, free educational materials at Bladder Cancer Advocacy Network. bebeta.com/bladder-cancer.html. bladder-cancer.da.cx. bladder-cancer-symptoms-inc.com. bladder-disorders.com. bladdercancercanada.org. blcwebcafe.org. britannica.com/eb/article-9126092/bladder-cancer. cancer.gov/cancer_information/cancer_type/bladder. cancer.org. cancerbackup.org.uk/cancer-type/bladder. cancerbackup.org.uk/info/bladder.htm. cancerhelp.org.uk/help/default.asp ? Page =2680. cancer-info.com/bladder.htm. cancernews.com/bladder.htm. cancernews.com/bladder.htm. ChinaMedline.org, Bladder Cancer Cures, Chinese Ministry of Health. electa.com/patient_international_bladder_cancer.php. emedicinehealth.com/bladder_cancer/article_m.htm. en.wikipedia.org/wiki/bladder_cancer. geneticcancer.com. goldbamboo.com/topic-t1118.html, bladder cancer treatment and symptoms. Imperial Cancer Research Fund. mayoclinic.com/health/bladder-cancer. mdanderson.org/departments/urology. medicinenet.com/bladder_cancer/article.htm. nlm.nih.gov/medlane+/bladdercancer.html. oncolink.upenn.edu/disease/bladder. oncolink.upenn.edu/disease/gallbladder. ricancercouncil.org/facts/bladfacts.htm, Rhode Island Cancer Council, bladder cancer. scottthornermd.com, reading, PA. sghealth4u.com.sg/health4u/urology. tellyscan.nk.nl/bladder2.html. tellyscan.nki.nl/bladder2.html. ultimate-cancer-breakthroughs.com. urologychannel.com/bladdercancer/index.shtml. urologyinstitute.com/html/bladder_cancer.html eurotoday.com/browse_categories/bladder_cancer vgenium.com, new drug wstl.edu/internal.aspx?ID =649, bladder cancer treatment information. Appendix cancers websites. Cancer of the appendix, also known as appendiceal. Cancer happens when cells in the appendix become cancerous. There are different types of tumors and cancers in the appendix, like carcinoid tumors, which develop in endocrine cells that create hormones. Mucin-assist adenocarcinoma, these produce mucin, a jelly-like substance. Pseudomyxoma peritoneus/PMP, the jelly belly syndrome, caused by mucinous adenoma and mucinous adenocarcinoma. Signature cell adenocarcinoma. Paraganglioma. Treatment varies according to type and stage of tumor. Cancer.gov/cancer topics/pdq/treatment/gastrointestinal carcinoid/patient, gastrointestinal carcinoid tumors treatment. Cancer.net/cancer-type/appendix-cancer, appendix cancer. cancerresearchuk.org/cancer-help/about-cancer/question/pseudomyxoma-peritone, pseudomyxoma peritonia. macmillan.org.uk/cancer-information/cancer type/pseudomyxoma peritone-pmp.aspx, pseudomyxoma peritone.apcn.org, appendiceal cancer advocacy network. Aboutcancer.com/appendix_cancer.htm, appendixcancer.appendix-cancer.com, appendixcancerconnection.pmpawareness.org, pmpawareness-organization.pmppals.org, pmppals network. pmpcure.org, pmpresearchfoundation.pseudomyxomasurvivor.co.uk, pseudomyxomasurvivor.shootoutcancer.org/appendiceal-cancer. What is appendiceal cancer? ncbi.nlm.nih.gov/pubmed ?term=appendiceal cancer, search PubMed database for appendiceal cancer. Cancer.gov/cancer topics/pdq/treatment/gastrointestinal carcinoid/health professional, gastrointestinal carcinoid tumors treatment.surgicaloncology.com/@title.htm, Atlas of Appendix Cancer and Pseudomyxoma peritone.cancer.gov/clinical trials/search/results protocols IRCHID =$9493464. Clinical trials, appendix carcinoma. Cancer of the esophagus website/esophageal cancer website/esophageal cancer websites. Cancer of the esophagus is in the gastrointestinal class of cancers. The esophagus is the tube that connects the throat to the stomach. When you eat and swallow, food goes into the esophagus and into the stomach. Esophageal cancer is a situation where malignant cells gather within the tissues of the esophagus. The most common symptom is having a hard time swallowing. There might be pain or discomfort behind the breastbone. There are two types of esophageal cancer: squamous cell carcinomas, adenocarcinomas. People with gastric reflux have an increased risk of esophageal cancer. cancer-genetics.org/x0703.htm, molecular biology of esophageal cancer. cancer.gov/cancer topics/pdq/treatment/esophageal/patient. Esophageal cancer treatment. cancer.net/cancer-type/esophageal-cancer, esophageal cancer. cancer.gov/cancer topics/wintk/esophagus/page 1, what you need to know about cancer of the esophagus. listserv.acer.org/script/war.exe?a0 EC Group, Esophageal Cancers Discussion Group. cancer.org/cancer/esophagus cancer/index, esophagus cancer. hosg.org, Humberside Esophageal Support Group. nhs.uk/services/service/default3.aspx?ID =10383, Northern Esophagogastric, Upper Gastrointestinal, Unit. Royal Victoria Infirmary. oesophagus.org, Esophageal and Gastric Cancer Awareness Campaign. The Northern Esophagogastric Unit, based at the Royal Victoria Infirmary.cancer-research.uk.org/cancer-help/type/oesophageal-cancer. Esophageal cancer. macmillan.org.uk/cancer-information/cancer type/oesophagus-gullet/oesophagealcancer.aspx, esophageal cancer also called cancer of the gullet. youtube.com, gullet cancer. cancerresearch.uk.org/cancer-info/cancers-tat/type/oesophagus. Esophageal cancer statistics. opa.org.uk, Esophageal Patients Association. aicr.org.uk/oesophagealcancerfaqs.stm, Oesophageal Cancer FAQs. ncbi.nlm.nih.gov/pubmed?term =esophageal cancer. cancer.gov/cancer topics/pdq/treatment/esophageal/health professional, esophageal cancer treatment. patient.info/doctor/oesophageal-carcinoma, esophageal carcinoma. Norway. oncolex.org/n/esophageal-cancer, cancer in the esophagus. startoncology.net, esophageal cancer. evidence.nhs.uk/topic/oesophageal-cancer, esophageal cancer. cancerresearch.uk.org/cancer-info/cancers-tat/type/oesophagus. Esophageal cancer statistics. seer.cancer.gov/statfacts/html/esoph.html, seer stat fact sheets. Esophagus. ncbi.nlm.nih.gov/pubmed. Gallbladder cancer websites. cancer.gov/cancer topics/pdq/treatment/gallbladder/patient. Gallbladder cancer treatment. macmillan.org.uk/cancer-information/cancer type/gallbladder/gallbladdercancer.aspx, gallbladder cancer. cancerresearch.uk.org/cancer-help/type/gallbladder-cancer. Gallbladder cancer. cancer.net/cancer-type/gallbladder-cancer, gallbladder cancer. nhs.uk/conditions/gallbladder-cancer/pages/introduction.aspx. Gallbladder cancer. youtube.com, gallbladder cancer. ncbi.nlm.nih.gov/pubmed?term =gallbladder cancer. cancer.gov/cancer topics/pdq/treatment/gallbladder/health professional, gallbladder cancer treatment. Norway. oncolex.org/n/bile-duct-and-gallbladder-cancer, bile. duct/gallbladder cancer. Pancreatic cancer info. The pancreas gland is an organ located at the upper abdomen near the backbone. It is instrumental in hormonal excretion, mainly to control blood sugar and make digestive enzymes. The islet cells produce insulin which control blood sugar. If you have pancreatic cancer, this is often disrupted, leaving you with higher blood sugar levels than normal, and because pancreatic cancer interferes with the production of digestive enzymes, you'll have problems with digestion. Most pancreatic cancer occurs in the ducts that carry pancreatic juices into the first section of the small intestine. Another type of pancreatic cancer begins in the islets of Langerhans cells that produce insulin. Cancer of the pancreas is often not detected until the later stages, when the cancer has already spread outside the pancreas. Symptoms are a feeling of pain or pressure in the upper abdomen, nausea, loss of appetite, weight loss, weakness, If the tumor blocks the duct through which bile passes into the small intestine, the person develops jaundice, which is a yellowing of the skin and the whites of the eyes. The urine probably becomes dark. Having diabetes increases the chances of developing cancer of the pancreas. There are several different types of pancreatic cancer, the two major classifications being either endocrine or exocrine. The precursors for pancreatic cancer are smoking, diet high in fat, low in fiber, alcohol abuse, and toxins in the environment. There is a genetic component. Approximately 30,000 people develop pancreatic cancer every year in the US, but the prognosis is very poor. At the present, most people won't survive it. The earlier the diagnosis, the better your chances. A CT scan can detect tumors on the pancreas and see whether they have spread to other nearby organs like the liver, lymph nodes, and stomach. Ultrasound and MRIs can do the same thing. If you develop jaundice, an endoscopic retrograde cholangiopancreatogram/ERCP can detect irregularities in the bile ducts. There is no specific blood test, but a substance in the body, CA19-9, is consistent with pancreatic cancer. Biopsies of the pancreas gland are also done. In a needle biopsy, the doctor inserts a long needle into the abdomen and then into the pancreas to obtain a tissue sample. A brush biopsy is performed along with an ERCP. The endoscope rubs off some cells with a brush attachment. A laparoscope can also be used to get a tissue sample. Because there is no cure of pancreatic cancer in the later stages, treatment focuses on controlling the symptoms of the disease. Oncologists use surgery, radiation therapy, and chemotherapy. They might remove a part or all of the pancreas. There are alternative treatments too. It's a tough disease. Books about pancreatic cancer are at #616.99437 or RC280 at the library. Cancer of the pancreas websites. With pancreatic cancer, the cells of the pancreas become malignant. The pancreas has two functions. Makes juices that help digest food. Produces hormones, including insulin, that regulate the use and storage of food. Most pancreatic cancers happen in the part of the pancreas that makes digestive juices. They are called exocrine pancreatic cancers. A few pancreatic cancers start in the hormone-producing part of the pancreas. They are called endocrine pancreatic cancer or islet cell cancer. Most exocrine pancreatic cancers are classified as ductal adenocarcinomas. Pancreatic cancers usually start at middle age. cancer.gov/cancer-topics/pdq/treatment/pancreatic/patient/page 1. Pancreatic cancer treatment. cancerresearchuk.org/cancer-help/type/pancreatic-cancer, pancreatic cancer. cancer.net/cancer-type/pancreatic-cancer, pancreatic cancer. macmillan.org.uk/cancer-information/cancer-type/pancreas/pancreatic-cancer.aspx, pancreatic cancer. nhs.uk/conditions/cancer-of-the-pancreas/pages/introduction.aspx, pancreatic cancer. youtube.com, pancreatic cancer. pancreaticcancer.org.uk, pancreatic cancer UK. pancreatic.org, Hirschberg Foundation for Pancreatic Cancer. Research. listserv.acer.org/script/wa-acor.exe?a0 panseries-onc. Pancreas-ONC, Pancreatic Cancer Support and Information. eCommunity. pancan.org, Pancreatic Cancer Action Network. pcrf.org.uk, Pancreatic Cancer Research Fund. cancerresearchuk.org/cancer-info/cancers-tat/type/pancreas. Pancreatic Cancer Statistics. pancreatica.org, Pancreatica, Confronting Pancreatic Cancer. Cancer Patients Alliance. lustgarten.org, the Lustgarten Foundation. cancer.gov/cancer-topics/wintk/pancreas/page 1, What you need to know about cancer of the pancreas. ncbi.nlm.nih.gov/pubmed ? Pancreatic cancer. Patient.info/doctor/pancreatic-exoserine-tumors, pancreatic exocrine tumors. HemaNC101.com, Management of Metastatic Pancreatic Cancer. oncolex.org/n/pancreatic-cancer, pancreatic cancer. cancerresearchuk.org/cancer-info/cancers-tat/type/pancreas. Pancreatic cancer statistics. cancer.gov/cancer topics/pdq/treatment/pancreatic/health professional, pancreatic cancer treatment. seer.cancer.gov/statfacts/html/pancreas.html, seer stat fact sheets, pancreas. ncbi.nlm.nih.gov/pubmed, PubMed. mdanderson.org/departments/pancreatic. imsdd.me.uni-bond.de/cancernet/100046.html. Lustgartenfoundation.org, 866-789-1000. oncolink.upenn.edu/disease/pancreas. pancan.org, Pancreatic Cancer Action Network, 877-2 Pancan. pancreatica.org. pancreatic.org. path.jhu.edu/pancreas. Stomach cancer website/gastric cancer website/Helicobacter pylori websites. Stomach cancer or gastric cancer happens when malignant cells attach or create themselves in the stomach tissues. Early symptoms can include indigestion, feeling bloated, mild nausea, loss of appetite, heartburn. Later symptoms are blood in the stool, vomiting, weight loss, pain in the stomach. Risk factors are prior stomach infection by Helicobacter pylori, smoking, diet of dry salted foods, Menetrier's disease, familial polyposis. Most stomach cancers are adenocarcinomas. There are several subtypes. cancer.gov/cancer topics/pdq/treatment/gastric/patient, gastric cancer, patient's information. cancer.gov/cancer topics/pdq/prevention/gastric/patient, stomach, gastric, cancer prevention. cancer.gov/cancer topics/pdq/screening/gastric/patient, stomach, gastric, cancer screening. cancerresearchuk.org/cancer-help/type/stomach-cancer, stomach, gastric, cancer. cancer.net/cancer-type/stomach-cancer, stomach cancer. nhs.uk/conditions/cancer-the-stomach/pages/introduction.aspx, stomach cancer. patient.info/health/cancer-of-the-stomach.htm, stomach cancer. cancer.gov/cancer topics/wintk/stomach/page 1, what you need to know about stomach cancer patients booklet. gastro.org, American Gastroenterological Association. can'tstomachcancer.org, Can't Stomach Cancer. nhs.uk/services/hospitals/service/default3.aspx?ID =10383, Northern Esophagogastric, Upper Gastrointestinal, Unit. Royal Victoria Infirmary. oesophagus.org, Esophageal and Gastric Cancer Awareness Campaign. canceraustralia.gov.au/affected-cancer/cancer-type/stomach-cancer, stomach cancer. aicr.org.uk/stomach-cancer-FAQs.stm, stomach cancer FAQs. Association for International Cancer Research. cancerresearchuk.org/cancer-info/cancers-tat/type/stomach.
Stomach cancer statistics. listserv.acer.org/script/wa-acor.exe?A0 Stomach ONC, Stomach Tumors Electronic Support Group. cancer.gov/cancer topics/pdq/treatment/gastric/health professional, gastric cancer treatment. cancer.gov/cancer topics/pdq/prevention/gastric/health professional, stomach, gastric, cancer prevention. cancer.gov/cancer topics/pdq/screening/gastric/health professional, stomach, gastric, cancer screening. patient.info/doctor/gastric-carcinoma.htm, gastric carcinoma. evidence.nhs.uk/topic/stomach-cancer, stomach cancer. amadeo.com/medicine/gca.htm, Amadeo Medical Literature Guide, Gastric Cancer. gastro.org, American Gastroenterological Association. path.up.edu/cases/case196.html, case study, 64-year-old woman with poorly differentiated gastric adenocarcinoma, Department of Pathology, University of Pittsburgh. path.up.edu/cases/case60.html, case study, carcinoid tumor, arising in a Meckel's diverticulum in a 70-year-old man. gastricbreastcancer.com, gastric and breast cancer. library.med.utah.edu/webpath/gihtml/gdx.html, gastrointestinal pathology. springer.com/medicine/oncology/journal/12029, Journal of Gastrointestinal Cancer. seer.cancer.gov/statfacts/html/stomach.html, seer stat fact sheets, stomach. Norway. oncolex.org/n/stomach-cancer, stomach cancer. cancerresearchuk.org/cancer-info/cancers/tat/type/stomach. Stomach cancer statistics. cancer-genetics.org/cdh1.htm, cdh1 genetic information. patient.info/doctor/helicobacter-pylori-%sign28hp%sign29.htm. Helicobacter pylori. bsg.org.uk/patients/general/helicobacter-pylori.html, Helicobacter pylori, patients information. cancer.gov/cancer topics/facts/het/risk/h-pylori-cancer, Helicobacter pylori, and cancer. ncbi.nlm.nih.gov/pubmed